welcome to Mind Matters. Today we are going to talk about therapy, and I'm sure you have come across this term in recent times in association with your mental health. Now, what does it mean? In psychological terms, therapy means a process of healing or treatment. Let's not get bothered with the term treatment, because if we go for treatment for our falling hair, for our skin, why not our mind? Now let's understand the different types of therapies used by psychologists. The first one is the most common one, known as counseling. Here, a counseling psychologist or a counselor uses talk as a medium to help a person feel better. Counseling is mostly used for milder mental health concerns. We believe sharing, expressing, or talking has healing properties. And when we do that with a professional, it's even better because your information is kept safe and confidential. The second form of therapy is known as psychotherapy. The nature of it is more deeper and specific. It's used by clinical psychologists or psychotherapists after undergoing a lot of training. Here, we mostly deal with mental illnesses. For example, in physiological ailment, if a person is undergoing fever or if the person is undergoing an upset tummy, we often give two different medication for two different conditions. It's very similar when it comes to psychotherapy, where we have different types of psychotherapies for different kinds of mental illnesses. For example, depression is a mood disorder where we use CBT, cognitive behavior therapy, to help the patient feel better. Now, for example, if a person has autism spectrum disorder, we often use something called applied behavior analysis. So you can see there are differences in the names of the therapies that I have mentioned here, and the treatment is also different. It's very similar to how we use different ways of treating a patient in any physiological illness. Lastly, let's understand what goes behind therapy. So mental health is a broadly used term which has biopsychosociocultural factors to it. So let's say if a person has anxiety, the person would be facing repetitive negative thinking, emotional turbulence, and along with that, a person also might have physiological conditions like facing palpitation, having dizziness, vomiting tendencies, shortness in breath, and a lot more. So what psychologists do here, we make them aware about what caused the anxiety. We make them understand the root of their problem. We help them deal with the coping mechanisms. We help them reframe their negative thoughts. We help them make changes in the lifestyle. Because when you take a medicine for your mental health concern, it only deals with the symptoms of it. So it will relax you a bit, but it will never teach you how to deal with the stressful event. Now let's say you have popped a medication for your mental health concern, you still go back to the stressful environment. If you stop the medication, you won't know how to deal with it naturally. So a psychologist would often help you through therapy to deal with these mental health concerns behind the symptoms. So that is why therapy takes a lot of time. We usually see a patient for almost 45 minutes to 60 minutes at a stretch. And the frequency of it is also based on the psychologist and the patient's condition. So here we have got to know about the commonly used term therapy today. Please stay tuned with us and get to know more about mental health.